Hey everyone, and welcome back to our series on chronic low back pain. Today we are wading into some deep water and talking about a really big topic, spinal fusion surgery. Look, it's a huge decision, one that people usually only consider after years and years of pain. So let's really get into it and see what the science actually says.
I bet if you've been living with this kind of pain for a long time, this exact thought has probably crossed your mind. I mean, of course it has. It usually comes from a place of just pure exhaustion, from wanting to get your life back. And that thought, it carries a ton of weight.
Okay, before we go any further, I want to be absolutely 100% clear about something. This is not about painting surgery as bad. It's not. And if you've already had spinal surgery, that decision was made with the best information you and your medical team had at the time. Full stop. Our goal here is just to explore the evidence so you can really understand when this particular surgery is the right tool for the right job.
So first things first, what exactly is spinal fusion? Well, at its very core, you can think of it as a structural solution that's designed to fix a structural problem. The basic idea is pretty straightforward. You take a part of the spine that's thought to be unstable or causing pain, and you essentially lock it into place. Surgeons use hardware, things like screws and rods, to permanently stop the movement between those specific bones, with the goal of creating stability and, hopefully, reducing pain.
To really get a handle on this, it helps to think of two totally different paths. Let's start with Path A. This is the path where the evidence for spinal fusion is, frankly, rock solid.
In some cases, fusion is an absolute home run. I'm talking about very specific identifiable structural issues. Things like spondylolisthesis, where one vertebra has literally slipped forward on top of another, or an unstable fracture where the spine is actually broken. It's also used for things like tumors or infections. See the pattern? In these situations, the problem is clearly structural, so a structural fix like fusion makes a whole lot of sense, and it works really, really well.
But that brings us to the second path. And honestly, this is the much more common one. This is the path for people with what's called non-specific chronic low back pain. And here, the exact cause is a whole lot murkier.
Now this chart, this is really important. It shows that for a whopping 85% of people with chronic low back pain, doctors can't point to one single clear structural problem as the cause. The pain is 100% real, of course, but the culprit isn't some obvious issue you can see on a scan. And right there, that's the central challenge, isn't it? If spinal fusion is a structural fix designed to lock down a specific problem area, what do you do when you can't be sure where the pain is actually coming from? This is the huge question researchers have been trying to answer for years.
Now, you might remember from our explainer on MRIs that they almost always show something, a bulging disc, some degeneration. But what we know now is that for most people, especially as we get older, those things are just normal signs of aging. They're like wrinkles on the inside, so they aren't a reliable target for surgery.
So how can we possibly know if fusion works for this massive group of people with nonspecific pain? Well, we have to look at the evidence. And this is where it gets really fascinating, because we have some incredibly powerful long-term data to help guide us.
Get this. Researchers took patients from 3 huge clinical trials across Sweden, Norway, and the UK, and they followed them for more than 11 years. Just let that number sink in. 11 years. In medical research, that is an eternity, and it gives us a really powerful look at how things actually play out in the long run.
And here it is, the results. After more than a decade, when they compared the patients who got spinal fusion to the ones who went through a comprehensive rehab program, they found no meaningful difference. Not in their pain levels, not in how much the pain interfered with their daily lives, and not in their overall quality of life. On average, both groups ended up in pretty much the same place.
So what does that mean? Well, this is the conclusion from the researchers themselves. It's not that surgery is bad. It's that for this specific group, people with nonspecific chronic low back pain, the evidence just doesn't show that it has any advantage over a really good, dedicated rehabilitation program.
Okay, so knowing that, how do you move forward? How do you make an informed choice for yourself? Well, it really means you have to weigh the potential benefits against some very real risks.
Look, any surgery has risks like infection or nerve injury. But with fusion, there are a couple of other things to be aware of. One is something called adjacent segment disease. Basically, when you lock one part of the spine, the parts above and below it have to move more to compensate, and that extra stress can cause new problems down the road. The other is failed back surgery syndrome, which is really just a catch-all term for when the surgery unfortunately doesn't fix the pain,
or sometimes even makes it worse.
And because of this evidence, a lack of clear benefit combined with the real risks, the major medical guidelines from big organizations in the UK, the US, and Japan all say the same thing. They do not recommend spinal fusion as a routine treatment for nonspecific chronic low back pain.
Phew, okay. I know that's a lot to take in. You might be thinking, great, so now what do I do? The goal here is not to make you feel lost or stuck. It's the opposite. It's to empower you. So let's talk about how you can actually use this information. First, have a really direct conversation with your doctor to clarify your diagnosis. Ask them straight up, is my pain from a clear structural problem or is it considered nonspecific? Second, talk about all the options. If rehab comes up, ask what a really comprehensive program would look like. And third, please get a second opinion. It's not an insult to your doctor, it's just a smart, standard thing to do before making any big medical decision.
Now, I can practically hear some of you thinking, yeah, but I've already tried physical therapy and I didn't do anything for me. So what now? And that is such a valid, common, and frustrating place to be. But it does not mean you're out of options.
That's why in our next explainer, we're going to dive into a totally different approach called spinal cord stimulation, or SCS. It's not a structural surgery at all. Instead, it works by changing how pain signals travel from your back up to your brain. It's another path to explore when the others haven't given you the relief you're looking for.
So we'll leave you with this final thought. At the end of the day, the goal is not to get a procedure. The goal is just to feel better, to live better. And the real question all this evidence asks is, for your specific situation, is this the path that's most likely to get you there? Thanks for watching.